Good afternoon, everyone, and welcome to the Community Pharmacy More Profit Roundtable. This is the mini version. We'll only spend the next 25 minutes or so going through some really important information for community pharmacies and healthcare providers in general. But my background and expertise has been 22 years helping community pharmacies. And so I love the industry. Will do everything I can to help them be successful. So that's why I do this program. So my name is Breck Rice, and I am the co-founder of ServeRx. ServeRx is a revenue cycle management company for community pharmacies. And then I also provide a couple of podcast series to help the industry. And one of those podcasts is the PBM Reform podcast on the Pharmacy Podcast Network, and we try to chisel away at that big mountain that is the PBM and insurance mafia. And it's a slow process, but we do everything we can to make positive changes there. And as you can see from this slide, the big payers are aligned with the big PBMs or pharmacy benefit managers, and they're aligned to pad their own pocket and take as much profit from healthcare providers as they possibly can. And so everything that I support with the Roundtable and the PBM Reform podcast is solutions to bypass the PBMs to help community pharmacies make and keep more profit. And so again, that's why I do this Community Pharmacy More Profit Roundtable. Now, I've been preaching to the community pharmacies for the past couple of years that they need to not have all their eggs in one basket. You can't just dispense medications any longer. You've got to diversify, and I believe 1/3 of your revenue needs to come from non-dispensing programs. And as you can see from this slide up, now, community pharmacies or independent pharmacies unfortunately have over 91% of their revenue coming from dispensing. That's a sad situation because the profit margin just isn't there any longer. Back 15, 20 years ago, community pharmacies were able to make about 35, 36% profit margin. And today that profit margin is as low as, 5 or 6%. So they need to expand and look at other solutions in order um, uh, to be more profitable and to provide more services to their patients. In fact, about 1/4 of all the medications dispensed from a community pharmacy today actually walk out the door below the acquisition cost of the drug. So they're not even covering the cost of the medication, let alone their overhead for their facility, their employees, utilities, et cetera. So one of the programs that I'm obviously a big supporter of is my own company, ServeRx. We help community pharmacies bypass those PBMs in order to make the fair reimbursements that they deserve. And it's one of the biggest issues for community pharmacy today is the status quo. Keep doing what you've always done and expect that you're going to have a better outcome. It's going the opposite direction. So we want to help community pharmacies get the fair reimbursements they deserve. And this slide here shows you just some examples of some pretty common medications, what the PBMs reimburse for those medications versus what ServeRx reimburses. The payer isn't paying anymore. If it's a self-insured employer group or if it's Liberty Mutual or Travelers, they're paying the same amount. It's the state fee schedule. The big difference is we pass that on to our pharmacy partners where the PBM is pocketing that other, $50 or $60. So I've outlined for today's presentation 3 steps to successfully do something different than just dispense. And that is the future of community pharmacy is clinical services. Whether you're ready to do it or not as a community pharmacy, you need to get ready to do this because this really is the future if you're going to be able to stay in business. I'm partnered with every PSAO, a pharmacy service organization in the country, where they're preferred provider for third-party billing, and which is a blessing to me and my company. But it's the downside of that is that I get the updates every time that there's a closure, and we're at one pharmacy per day now going out of business. So We've got to help the industry, or we're going to have pharmacy deserts all over the country. And it starts with these three steps here. First step is remote therapeutic monitoring and the RTM program, which is an amazing new CPT code covered by CMS or Medicare that now can be done through community pharmacies. So most of the CPT codes approved by CMS were really directed at providers, at doctors, which is great because it does provide some amazing in between appointment solutions for for patients. So like chronic care management, for instance, or remote patient monitoring. RPM is a great program to check in with patients in between appointments. So those are amazing CPT codes that have been around for a while, but the new kid on the block is this remote therapeutic monitoring. So I'm going to tell you how that program works for community pharmacies and providers with the Brain Health Plus platform. So that's step one. Absolutely no cost to the provider to set this up and help your patients in a way you've never been able to help them before. Step two is doing medical billing and expanding your scope of services into other solutions for becoming a community health center. This is not taking the attribution away from the local doctors. This is actually partnering with them. So it's really a win-win-win. The patients win because they have faster, more accessible access to care at a community pharmacy. There's a recent statistic that I'll share for you is that 22% of the nation's population are in rural communities, but yet only 11% of the doctors serve that 22%. So there's a real imbalance. And so community pharmacies can pick up that slack and help those rural community doctors get to all of those care gaps that are being missed today. That program is called IPPN, or the Independent Pharmacy Provider Network. Happens to be the fastest growing community health collaboration in the country right now. I think they're in about 20 states, several hundred pharmacies participating, several thousand doctors that are in the network. And then step three is a full brick and mortar clinic at the community pharmacy. Again, not taking the attribution away. It's not like the minute clinics or those village clinics or whatever that are run by NPs. This is truly an extension to the local provider. So in collaboration, that is a HIPAA compliant clinical room. And again, these are the three steps that we're going to cover this afternoon briefly. And what I want to point out here is you can do step one all by itself, never take step two and step three. You just can't do step three without step two. You need step two. You need those collaborating doctors, and you need to be in network with the payers in order to do the full BRIM Wellness Center or brick and mortar clinic. So let's first talk about the remote therapeutic monitoring, and I alluded to the other programs, chronic care management and remote physiological monitoring, or RPM. I always call it remote patient monitoring. CCM came onto the scene back in 2015 and was the first CPT code to be approved by Medicare for remote care to patients, again, in between their annual visits or their checkups with their doctors. Was focused on taking it to the doctors to expand that program to that doctor's patients. The same in 2019 with remote physiological monitoring, now adding devices so that you can get blood pressure, blood sugar levels, all different kinds of remote care solutions that we're actually giving us data back now too. Wonderful program if done right. Then the new kid on the block here is the remote therapeutic monitoring. For the first time, this doesn't require the PCP to enroll a patient. So this now can be offered for community pharmacies to offer this remote therapeutic monitoring program to their own senior patient population. And it is really quite easy to qualify a patient for the program. If you look here on the far left-hand side, you'll see the conditions that are covered, mainly musculoskeletal disorders, but also respiratory issues and medication management. In the middle are the symptoms, pretty broad: pain, stiffness, weakness. I'm not quite a senior myself. I'm getting closer every day, but I would qualify. I have some pain and stiffness. So it's pretty easy to qualify your patients for this program. The outcomes are addressing a lot of things here, but the main two concerns that seniors have, if you were to go into any senior center and survey them on what their top concerns are, the top two concerns are loss of memory and loss of balance. This addresses both of those concerns along with a lot of other things, pain relief, stress, a lot of other things that this program will improve. Why is Medicare really wanting this rolled out to seniors? Because they're spending billions, billions with a B, just addressing things like falls. Still, the leading cause of injury-related death with seniors is a fall. They project that the addressing falls will more than double, over $100 billion in the next 5 years. And there are studies and statistics that show that patients that have some cognitive impairment are more likely to have a fall. I was just speaking with a pharmacy partner of ours in North Carolina just a couple of weeks ago. His own brother-in-law has dementia really bad. Fell down, broke his hip, unfortunately, had to have a hip replacement. Well, the poor guy has fallen 3 or 4 times since because he forgets that he had the hip replacement. And so he'll get up out of bed and try to just walk into the restroom on his own and not take the walker and fall down again. So it's really, really a sad situation. So these are real things happening today, and you can make a difference in these programs. By age 70, 80 years of age, 2/3 of all seniors are experiencing some kind of cognitive decline. In fact, now someone is diagnosed with Alzheimer's disease about every minute now of every day. So the programs that you'll be able to offer through remote therapeutic monitoring will have been clinically proven to delay or even prevent the onset of dementia. So an amazing statistic. In fact, the statistic I like to use, and it's not even listed here, is that if a senior is involved in a remote therapeutic monitoring program, they're 75% less likely to get dementia. And again, this is a turnkey program that is provided by Remote Care Today. They're the ones that have built the platform called Brain Health Plus. This 2-minute video will explain the full program better than I can.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug-to-drug interactions, and even geofencing alerts, so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part. We do it all for you. You get a fully turnkey solution. Flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you. Powerful for your patients and great for your pharmacy. Click the book a call button to schedule a demo and bring it to your pharmacy today.
So as you can see, very comprehensive program. Couple of things that I love about it is that geofencing feature. So notify loved ones if a senior ends up, having to go into the hospital. And then that bio scanning, that's like James Bond technology right there. I've played around with it, and it is scary accurate. It is very, very accurate, and it's pretty fun to play around with. But a real easy way for a patient to check in on their own health. But every provider will also have access to that too, so you can use that as a patient engagement tool right there at your pharmacy or your doctor's office. So again, as it was mentioned in the video, it's covered by Medicare Part B. You don't need to worry about being in network with Part B. Most of our pharmacies are not. I know you're covering the drug side or the Part D side. Don't need to worry about that because remote care is in network and all their providers are in network. Most Advantage plans are also covering this as well. In fact, some commercial payers are covering this too it's a kind of a case by case basis. But what remote care today will do is an insurance verification on every patient before they even start the program. So they'll know exactly what's covered and what's not covered. About 80% of the patients won't even have a copay, but for those 20% that may have a copay, they'll know that up front before they even start the program. Now, I do want to share one testimonial with you. This is one of my favorites because Paul here is 89 years old. He admits that he hates to exercise. He hates to exercise, but he'll do this program called Ludafit, which is really making him exercise, right? But it's making it really fun to do it because it's more like a gaming system. And this Ludafit actually it's just one of the tools on the Brain Health Plus platform, but it's one that actually has the most clinical studies done on it already. In fact, a version of Ludafit is already being used in over 500 rehabilitation centers nationwide. So let me show you this little testimonial from Paul.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising, and they wanted to try it, and they were laughing, and and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
So I love Paul's testimonial, and I think it's funny that he says you're supposed to be avoiding obstacles as he skis right through a boulder. But what I like about it most is that this program shows that it can reverse muscle atrophy. When he first started it, he had to hang on to a chair to balance himself, and now he's doing it without any support whatsoever. Now, remote care today does want this to be completely turnkey, so they're providing all of the patient education materials. They're even providing prescription bags with the information printed on the bag for you. No cost ever to you on any of these educational materials. And they'll even set up a landing page for you So it's like your own website for the program that you simply just direct patients to that landing page. On that, you'll want to have a little welcome message from you or whoever the face of your clinic or pharmacy might be. It's just a recognizable face. So when the patients go there, they know, oh, hey, that's my pharmacist. And Remote Care Today helped that script that out for you. It's just a little 20-second welcome, and then you can get started on the program. So the last thing I want to share with you here is just the um, what the actually, let me show you this first. So what you will do from your standpoint, other than directing patients to getting additional information, you actually get to review their progress on a monthly basis. And for doing that, you'll get compensated for it. So this 30-second video shows you what you do.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
Wanted to show you that first so that I could show you this slide. So in this example here on the right-hand side, if you had 100 patients on the program, that should take you less than 2 hours to do those reviews. It's about a minute per review. So not a bad compensation for your time at $1,250 an hour. Obviously the more patients on it, the more that it'll be. So it's a $25 PMPM or per patient per month is what the review, what the administrative review fee is back to your organization. If you have multiple locations, you can centralize this. We're setting up a group of pharmacies up in New York. They have over 100 stores, and they're going to have a clinical pharmacist do the reviews for all 110 locations or whatever that they have. So step 2 was the IPPN or Independent Pharmacy Provider Network. These are the 4 pillars for success right here. I can also tell you that these are the pillars for failure if you don't do this correctly. You need to have a turnkey software solution in order to be able to do your patient notes and scheduling. It's basically your own EMR EHR system that's user friendly and built for ease of patient engagement. You've got to have a CPA or collaborating practice agreement in place. IPPN brings providers. They have providers already in all states that are already credentialed with Medicare, but we want to recruit the local providers to your pharmacy because you're going to be able to fill care gaps for them and really help their practice as well. So they help with that recruiting. And then, of course, the main thing is you need to properly know how to bill and collect for those services. So some of the early adopters, pharmacies that tried to get credentialed to do medical billing, some dear friends of mine, got into network, started performing services, and then couldn't get paid for those services. So we want to avoid that. And one of the benefits of working with IPPN is the CEO, spent 16 years with CMS. So he actually helped develop the quality measurement scores that doctors are measured by today. So he sees all the care gaps. He knows what needs to be included to get compensated. Some of the lowest hanging fruit here are like the continuous glucose monitoring program. Today, community pharmacies are basically giving away that service. They're helping their patients set up their glucose monitor, showing them how to get their data, and doing that just out of the kindness of their heart. But when you're in the IPPN program, you can actually bill for that. Those are covered. Consulting fees, the CPT codes there, you see the 95249 and through 95251. Those are the different things. And so each patient is approximately $2,500 per year to the community pharmacy, and that's the net side, even after the provider is compensated for managing the care plan. Other CPT codes like the preventative health codes here, 99391 through 99397, that turns your immunizations into a preventative health visit. So instead of just getting reimbursed, $17, $18 for a flu shot, you now are eligible for an $85 preventative health visit. So just some low-hanging fruit for pharmacies to be able to capitalize on when working with IPPN. And then step three was the full brick and mortar clinic. I'm just going to quickly highlight the three-legged stool here. First leg of the stool is the setup of your clinic and the managed services. You own it. It's your clinic. You name it whatever you want to name your clinic. Most pharmacies name it after their pharmacy. But Brim Wellness is kind of like the Intel inside. So it's, optimal wellness clinic powered by Brim. And then the second leg of the stool there is really unique. Brim is bringing in lab services where you can actually get real-time lab diagnostics without sending it out to Quest or whoever the patient would need to wait around for a week or so to get their lab work. They will be able to get their results in like 10 minutes while they're waiting for a prescription. Well, you need a phlebotomist on staff. Not very many pharmacies have a qualified phlebotomist on staff. So the second leg of this stool is like imagine it's like Uber, but for medical staff. You post a shift. Hey, I need a phlebotomist on Thursday at this time, these hours, and somebody fills that shift for you. So it's a really cool. Bring in people as you need them. And then the third leg of the stool is actually what I'm most excited about is the credit vehicle. So you can borrow from the pharmacy fund to build out your clinic. And then when you pay the pharmacy fund back, not only are you helping the next community pharmacy set up their clinic, you're earning interest on that money because you're now a collaborating member of the pharmacy fund. So someday in the future, you want to retire, you want to hand your pharmacy down to the next generation of community pharmacists, and this will be part of your retirement when you do that. So I appreciate everybody's time and coming out and hearing about these amazing services that can bring more profitability to your community pharmacy. Again, recapping the three steps here: remote therapeutic monitoring with Brain Health Plus and Remote Care Today. Step two is the Independent Pharmacy Provider Network, which I encourage everyone to get a full demo on that program as well. And then step three is the full brick and mortar clinic room. So appreciate everyone being here today. I absolutely love community pharmacies, and I'll do everything I can to help them be successful.